Hello, my name is Dr. Jerry Volchek. I'm one of the allergists in the allergy division at Mayo Clinic in Rochester, Minnesota. And we're going to have an article in the upcoming Mayo Clinic Proceedings entitled Food Allergy, Common Causes, Diagnosis, and Treatment. And part of the reason for writing this review article was there are a lot of misconceptions about food allergy and other reactions that people can have to food. And this is seen in our clinics, but also it comes up just in casual conversation. And there are some misconceptions about it. So in our paper, we're focusing primarily on the classic allergic or classic IgE-mediated reaction to food. And then we also mention the other immunologic and non-immunologic type of reactions that people can have. So focusing on classic allergy, one of the nice things about that is it's a rather stereotypic response from a time standpoint. And this is helps separate it out from other types of reactions people can have to food. So with a classic allergic reaction, people will typically start developing symptoms within minutes of eating the food up to about an hour. And the key thing is every time they eat the food, they should have a reaction in that time frame. Now, the tricky part is the reaction can be a little bit different each time, and also it may not be as severe each time. When you think about what are the symptoms of a classic allergy to food, the way I like to think about it is think about histamine being released from the different organ systems and what that ends up causing. So from like the oral pharynx and the skin, people can get hives and swelling. And again, this is usually within minutes of eating the food. From the GI tract, it could be nausea, vomiting, diarrhea. Respiratory-wise, you can see wheezing, shortness of breath, or cough. And in real severe cases, anaphylactic type symptoms, the cardiovascular system is even involved with hypotension and tachycardia. Now, where it gets a little confusing is it could be any combination of these symptoms. So somebody may just have a few hives as their manifestation of an allergic reaction to food, or they could have all of the symptoms involving all of the organ systems of the body, and then everything in between. The key, though, with the food allergy is it's going to happen each time you eat the food, and again, usually within that few minutes up to an hour time frame. So oftentimes people ask, what is the most common types of foods that will cause food allergies? And even though any food has that potential, there are a few that are clearly more common. And there's 8 that are considered the primary food allergens. And these include milk and egg, wheat, soy, peanuts and tree nuts, and then fish and shellfish. The majority of allergies to food will start during childhood, and the good news is for the child with milk and egg allergy in particular, they will usually outgrow that allergy. Unfortunately though, if it's peanut, tree nut, fish, or shellfish, that does tend to be a lifelong allergen. So in adults, the more common ones that we typically will see will be the peanut, tree nut, fish, and shellfish variety, whereas the majority of adults have already outgrown a milk or egg and oftentimes a soy or wheat allergy. Now there's some interesting cross-reactivities that can occur with these two, so it's important to realize that if you're allergic to one food, you may be at risk for sensitivity to other foods in the same group. For example, if you're allergic to a tree nut, such as a pecan, there's 35 to 40% chance you may also have a sensitivity to another tree nut, such as a cashew. And with fish, let's say you're allergic to salmon, there's about a 50% chance you could be allergic to another non-shellfish, such as a swordfish. Probably where the most cross-reactivity is seen is with the shellfish. So let's say you're allergic to shrimp, there's up to a 75% chance then you would also react to another shellfish, such as a crab or lobster. So it's important to realize this once a food allergy is identified. We also in the article talk about a couple other associated type of problems, and one is oral allergy syndrome. This is an interesting phenomenon when people have seasonal allergies to the tree, grass, and weed pollen, that there's a shared homology with certain allergens that are in foods, particularly fresh fruits and vegetables. For example, if somebody's allergic to birch tree pollen, which pollinates in the spring, causes typical watery, itchy eyes, runny nose, they also can develop itchiness of the mouth if they eat an apple because of the similarity there. Other combinations include ragweed allergy, predisposing people to getting that oral allergy syndrome or itchy mouth with watermelon. And there's a whole host of fruits and vegetables that can cross-react homology-wise in people with these seasonal allergies. When people have had a reaction after eating a food, fortunately there is testing that can be done to try and sort out what was causing the problem. Skin prick tests and specific IgE testing to foods can be done to help identify the particular food that caused the problem. These tests, though, aren't 100% perfect, and you have to really coordinate the clinical history with what you're seeing with the testing. So for example, if a man had a fish dinner and upon completion of that started breaking out in hives, had some gastrointestinal symptoms, you would skin test to the foods that were eaten and then look and see which ones were positive. You know, and especially with the example of fish, we know that's a common allergen, particularly in adults, and that could be identified and then dealt with. Unfortunately, though, we don't have a treatment other than recognition of the allergen and then also being aware if a reaction is starting. Using injectable epinephrine is one of the quickest ways to stop an allergic reaction in its tracks. And for all people with food allergy, we do recommend that they carry an injectable epinephrine. Currently, there are studies being done to see if desensitization to foods can be done either orally or sublingually. These are not yet readily clinically available, but hopefully down the road there may be options along those lines for people. So overall, what we do in the article is primarily outline the main symptoms of a classic allergic reaction to food, the most common foods that tend to cause these, the foods that can be cross-reactive that could also cause problems for people, and then some of the basics of managing somebody with this. Thank you very much.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.